Dance Arts of Columbia provides fitness fun for everyone from 3 years old to adults. Dance Arts is a good environment where the friendly staff makes you feel comfortable. Dance Arts feels that dance is an art form that you can experience firsthand by learning tap, jazz, modern, musical theater, lyrical, and ballet. Dance Arts urges you to enjoy a sense of accomplishment while getting fit and having fun. For class information, call 875-1569. Dance Arts of Columbia, serving Columbia since 1979.
Good morning and welcome to Radio Friends on Monday, July the 13th. We've got three guests with us today, but let's start first of all with Dr. Arun Kumar. Good to have you here, Doctor.
Thank you, Paul.
From MU Healthcare. And we're talking about really a revolutionary new procedure today to insert a heart valve in someone who could not withstand traditional surgery, right?
That's right. This is a procedure, the term we use is TAVR, but it involves individuals. Normally a traditional heart valve replacement would involve opening the chest through the sternum and then taking out the valve, putting an artificial valve in, and then closing up.
Yeah, and to do that, you also have to separate the ribs,
the sternum, that's right.
And that's a pretty serious operation.
It is, but it has a very low complication rate and high success rate in the average patient. However, we have some very high-risk individuals who are older, have a lot of other health conditions where this surgery would be higher risk, and this is where this new procedure would be of benefit.
And the new procedure, you simply go in through an artery?
Yeah, it's similar in ways to a cardiac catheterization or heart cath, if you're familiar with that procedure, which would involve going up the leg. There's also a technique to make a small incision on the lateral side of the chest, using x-rays, inserting a valve, and then placing the valve from the inside without having to open the chest.
Okay. Now, my question is, why not use this procedure on everybody? Because it seems it's minimal invasive.
That's right.
It seems like it would be much better for the patient.
Yeah, the recovery is less and the risk is less. However, it's only been studied currently in the highest risk patients and the patients who are not candidates for traditional surgery. So because we don't have trials in patients who are lower risk or even intermediate risk, we can't offer the procedure for that group. Those trials are ongoing though, and we expect that this procedure will be available for all comers.
So if somebody listening today heard about this and they have to have a valve replacement, and they came to you and said, Doctor, I want that valve replacement the way I heard them talking about it on Radio Friends.
Right.
And if they're not high risk, you can't do it yet.
Yeah, we would do a full evaluation we have a valve clinic. We would do a full assessment. We look at things more than just what other health conditions we have. We do a frailty test. We want to see how strong and what is the risk of surgery.
When do you think this could be approved for everyone?
We hope that within the next 5 years, the intermediate risk person will be offered this procedure. Then they'll look at the lower risk patients. So we think just like stents have come in for hearts where prior we had the surgery, now that we have stents for the heart arteries, we think for the valve, this will be available to all patients in the future.
I mean, that sounds, we don't want anybody to have to go through that, but it just sounds so much better than going through that major operation. Doctor, thank you so much for coming by. If people want more information, how could they go about getting this?
Yeah, to schedule into our valve clinic, the best contact number is 573-884-0296.
Okay, Dr. Arun Kumar from University Healthcare. Good to have you here.
Thank you,
Good
Paul.
meeting you.
Thank you.
Okay, now I turn to two ladies over here. I said we had three guests today, and we have Central Missouri Community Action. Julie McNEILL, good to have you here, Julie.
Thank you for
and
having us.
Margaret McGEEHon.
That's it.
Yeah,
Nice to
good
meet
to
you.
have you here, Margaret. Tell me about the Central Missouri Community Action, the message you want to get across today.
Well, our program is foster grandparents, and it's operated through Central Missouri Community Action. And the program that we serve is for individuals 55 and over that are not currently employed and would like to continue to be active in the community by volunteering. And we work with special needs children helping in schools, Head Start centers, and nonprofit child care facilities. And our program operates in Boone County, but we also have 9 other counties here in central Missouri that we operate with volunteers as well.
So what are you asking volunteers to do?
Well, they work with special needs kids, and that can mean a lot of different things. It can be physical, mental challenges that the kids have, or it can be academically. A lot of times our volunteers work with kindergartners, first graders, to really support them in academic areas, especially in reading and literacy.
So are they doing this, the volunteers, are they doing it at the child's home, or are they doing it at school? Or
We operate strictly at a location, so it's at a school, a Head Start center, or a nonprofit child care.
Okay, so
they
you're
go
not
to
going
the
in,
kids.
you're not going into the child's home.
Right, right. There is a program, foster parenting, and our name is kind of similar, and that gets a little confusing with the state that you bring children into your home and help care for them. But this is different. We're foster parents and we're foster grandparents, and we volunteer at a facility with children. About 15 hours, 20 hours a week is what our volunteers do.
Okay, so what do you have to do if you want to become a volunteer? Obviously, you have to go through some background check, right?
Right, absolutely.
What
Anybody that
happens?
works with children is required to go through a number of background checks, including an FBI screening. So we do an interview. We ask for information from a physician saying that they're mentally and physically able to volunteer. We do the background checks. And then we do some training to prepare them to work with these special needs kids. They're really a big support for the teachers and the Head Start directors who have a large class of children, and really our volunteers are able to work one-on-one with them and support those kids based on what the teachers direct them to do.
Do you make a time commitment saying, I will commit to this for 5 months or 6 months or a year?
Yes, we'd like someone that's going to stick around and continue in our program. Our volunteers are required to do volunteer 15 hours a week because we want them to be consistent volunteers to, build that relationship with those kids.
If they want more information on this, what's the telephone number to call?
573-8706.
Okay.
Extension 1131 is directly to me, and I'd love to talk to people more about the program. We are recruiting, and we do pay a small stipend to volunteers for their efforts in volunteer
And I'm the
programs.
volunteer coordinator, and my extension is 1129.
Okay, so you
Either
can
one
call
of us would
Margaret.
be
We didn't
great.
get to talk to you too much there, Margaret. So give
I'm
Margaret
a good
call.
listener.
What's your extension number?
1129.
1129. Okay. Thank you so much for
thank
coming
you.
by. Best of luck to all of you for what you're doing. Tomorrow, Vera Massey will be with us, University Extension. Our program directed by Travis McMillan, Reynolds Journalism Institute. Audio is Pat Akers from KBIA. Our floor director, Lowell Thomas, and our assistant producer and guest coordinator, Uncle James Mauser. If there's something you'd like to hear, drop me an email, pepperp@missouri.edu. Bye-bye.